I'm talking to Helen Christophers, who is a freelance sexual health consultant. She was formerly the Senior Programme Manager for the Health Education Authority in the UK, which launched the National AIDS Campaign. Helen, before we start, can we put HIV/AIDS in the context of other sexual pandemics? How big is it?
Well, I think at the moment we've got about an estimated 34 million people living with HIV worldwide. And I think that when the AIDS pandemic first started, we hadn't seen the likes of it before. It was obviously and is obviously one of the most deadliest epidemics and still one of the top causes of death worldwide. I think in poorer countries especially, it wreaked havoc with young lives, it devastated families and communities, and obviously seriously impacted local, regional and national economies. I think that there is some cause for optimism. Now we have the tools, we have developing prevention technologies, and we have effective drugs which can stem the course of the epidemic, but certainly there's still a long way to go.
When AIDS was first killing people, what was the level of awareness about what was happening?
I think there was not a great level of awareness at all. I mean, the first notification of this illness called AIDS, which initially was associated with gay men and drug users, came from the States. And there was very little known about it. Eventually they identified that it was transmitted through sexual contact, through sharing injecting equipment, and that's when really the maelstrom started, the press, the confusion, the misunderstandings. So I think for a long time the science took a bit of a backseat until the science community knew exactly what they were dealing with, and it took time. And in that time, lots of misunderstandings, lots of stories developed across the world.
And how did the National AIDS Campaign come to be set up?
Well, I think most people in this country will remember that the government actually took very prompt action from the beginning, and that has probably been responsible and contributed to the fairly low prevalence in this country now. But the government started a very high-profile campaign in 1986-87, and most people remember the tombstones, the icebergs, the apocalyptic messages that went with them, and really that was the government's attempt to say to everyone, we've got this disease, we don't know how quickly it's going to spread, and you need to be aware of it. And there was, with that campaign, there was a leaflet drop to all households in the UK. So awareness levels about the term AIDS and about how it was transmitted were very high, but the government then decided to hand the responsibility for the public education over to the Health Education Authority, and they took over in 1987, sat back, reflected on where we were with HIV and AIDS, and looked at how we could sustain a campaign which was going to be effective in informing people about the facts.
And that apocalyptic nature of that initial campaign, was that based on projections for the spread of the disease, or was it? It
was based on early projections, but also I think just an uncertainty about how quickly the spread would continue. So the initial projections were very high, and inevitably when you go on television, when you're using the mass media, I mean, I think that with the onset of AIDS, mass media was used in a way which was unprecedented before, in health promotion anyway. So you had an enormous kind of awareness developing. You had editorial across TV was extremely strong, so everyone wanted more information, but obviously the scientific community wanted to be cautious because the projections were based on information which was difficult to capture. There's a time lag between infection and often the diagnosis, so there are all kinds of complicating factors factors which made accurate projections very difficult.
And how did you get involved in the campaign? What was your role?
Well, I was working at the Health Education Authority on a general health programme and was moved across to coordinate the public education campaign. So I coordinated the advertising agency and worked with specialists, worked with the key voluntary sector organisations to ensure we were on message, to ensure we had the right advice. Obviously, the political nature of the campaign meant that I also worked very closely with ministers at the time and with the government. So my role really was to ensure all the elements of the campaign came together and that whatever we were saying about HIV and AIDS was as accurate and as appropriate as possible.
And you touched on the political aspects. What did the Conservative ministers of the day, Norman Fowler and Ken Baker, think of spending so much money on people like drug addicts and gay people?
Well, I think that the nature of the epidemic and the behaviours that are implicated meant the whole thing was challenging for everyone involved. There were moral issues, there were sexual issues involved, and at that stage, the British approach was very much don't talk about sex or anything, it's a private matter. So I think it was challenging for everyone, but certainly Norman Fowler picked up the baton very well, and he ensured there was money set aside, ensured that the action was taken when necessary, that opinion forming politicians, the media were aware of just how serious this issue was. And even today, I think he's just in a couple of years ago he's been presiding over a new investigation into HIV and AIDS and looking at now 20 years on, what are the current needs, where have we got to, and what needs to still be done. So he's still very much involved, so committed from the start. I think there was tension amongst the various political leaders at the time because of the very sensitive nature and because they were thinking of their constituents and what the government was doing, and was that the right thing to do. So I think it was an interesting time, certainly.
And this issue of privacy was particularly key, wasn't it? Because Margaret Thatcher withdrew funding from a national study on sexual attitudes and behaviour because she thought it was too intrusive.
That's right. I mean, that was a very difficult period because obviously the more information you have about how people behave, what they understand, what their attitudes are, then the closer you can get to actually giving a message which is meaningful. So for those of us who were working across the sexual health side, the national study was critical, and so it was very disappointing when the government eventually pulled out, but obviously it got private funding, and again today it's still happening. So the kind of surveillance information we get about the disease combined with the information we get from various studies means that a lot of the work in this country is very well informed and based on the evidence of what we know of how people behave, how many partners they tend to have. So that's all very critical.
And just again, in terms of difference of political attitude, what was the difference between Margaret Thatcher and John Major in those years? Well,
I think that probably Margaret Thatcher, had the kind of impact on the AIDS campaign that she had across government. I mean, she wanted to be involved. She wanted to know the bottom line and what was happening. So she was, although at a distance, number 10, and therefore Mrs. Thatcher was very much informed about what was happening. I think that John Major may well have taken more of a backseat as ministers came to the forefront as the kind of temperature around HIV and AIDS cooled slightly. But certainly I think it was in the nature of Margaret Thatcher to make sure she was very central to any key decisions that were being made.
And what was UK NAT's relationship and role in relation to the independent trusts like Terence Higgins? Because sometimes there were different views taken and different sort of strategic ideas about how, in a sense, the disease should be explained and combated.
I think what we recognised is that we all played our part, and obviously someone like Terence Higgins Trust and the National AIDS Trust were very much closer to the client group, to people living with HIV and AIDS, and we worked very, very closely with organisations in the voluntary sector, and they advised us heavily about what was happening, about much more kind of street knowledge that we could as a government agency never have got. So the relationships were very close. That's not to say there wasn't tensions, particularly in terms of the campaign targeting gay and bisexual men, because that is something that Terence Higgins Trust had worked very closely to, and inevitably they're very pragmatic, and therefore might have, if they had been running the campaign like they are these days, may have taken a much more pragmatic, upfront approach. So I mean, I think we recognised, valued each other's opinion, but recognised we played different roles, and our role was somehow to sit between the government of the day who was funding this and the public who were going to be receiving these messages. So a delicate balance.